Hey folks, Dr. Joe Esposito here. I am glad you're with us today. Now, if you're new to the show, you may not know this, but we get a ton of questions on our website, and I'm always amazed, like 2 o'clock in the morning, 3 o'clock in the morning, they're coming in. So you, the listeners, have health questions, and I try to answer as many as I can for you. So what I've done is I've kind of compiled a lot of these questions and other symptoms that may pop up, and these are common ones we get, and I want to answer them for you. So we're going to do that right now. Now, if you have any questions, you can always send them to me through the website, drjoe.com, drjoe.com, and there's a little bot that pops up. It says, would you like to chat? Type in your question, give us your email address, and I'll get back to you as quickly as soon as I can. Now, again, if you're typing it in at 2 o'clock in the morning, chances are I'm not going to be sitting there answering your question right away. In all the years I've been doing this, only one person got frustrated that we didn't answer immediately, because we can't answer immediately. We have other things to do as well, but we get back to you as quickly as we can. So let's jump right into it. This is a common one. Do you know somebody who does this a lot? Clearing their throat a lot. That can be a sign of several different things. The most common one that I find is that the person's stomach is pushed up into the diaphragm. And when the stomach pushes up into the diaphragm, it causes acid reflux, sometimes called GERD, gastroesophageal reflux disease. The acid is coming up into the esophagus and irritating, usually the vocal cords. And so you're clearing your throat, you're coughing a lot. Very common situation, and usually very easy to fix. But here's the thing. It's a warning sign. It's telling you that there's something wrong. And to ignore it, not a good idea. Now, if you have a cold or if you have an infection or something like that, that can cause a little chronic cough. But if it's ongoing for a long time, many times it's a stomach pushed up against the diaphragm. And my doctors are all trained to treat that, because I have that condition, where we can actually take the stomach and pull it down away from the diaphragm. We could adjust the stomach and pull it down away from the diaphragm. To pull the stomach back down, it closes what's called a sphincter, or a little muscle between the esophagus and the stomach. It's in the diaphragm, and that prevents the acid from coming up into the throat. Too much acid in the throat can be a serious issue. It can erode or eat away at the esophagus. And ultimately, if it eats away at the esophagus, it could lead to things like esophageal cancer. Not uncommon. I see it a lot. I've known people for years. In fact, I met somebody one time years ago, and her husband had died of esophageal cancer. And she was then socializing and going out again. And she said to me one day, she says, listen, I'm a big fan of your show. I listen to the show all the time. It's curious that you're probably the only person that could have saved my husband's life. She says, but I would have never met you because I was married. She wasn't out socializing with the, folks. And she said, I just wish I'd known this. Who knows what would have happened? And again, I don't know if I could have saved his life or not. I have no idea. But it's very common. And she said, it's exactly it. The acid was coming up into the throat. Doctors couldn't do anything about it. Put him on acid reflux medications. He couldn't digest his proteins because it shuts down stomach acid. And then eventually got worse and worse, and he passed. So it's an interesting curiosity. And I think this a lot. What if the science that's out there and healthcare actually got together? There wasn't such a disconnect. Because we know that the number one treatment for back pain, most effective, least expensive treatment for back pain, is chiropractic care. Science is clear. The treatment that goes on is not. If we know this is the most effective, least expensive treatment, everyone should say, let's start with chiropractic care for back pain. Let's do that. If you have acid reflux, most cases, not all, you should see my doctors, or somebody who knows how to pull the stomach down away from the diaphragm, as a starting point. So the science is clear. The procedures are where there's a disconnect. And I don't understand why that is. Well, doctors don't know. First of all, not everybody knows everything. Number two, it's a profit center. I mean, it's a business. It's the business of healthcare. And so it's a business. And so there's money to be made there, which is unfortunate that sometimes people suffer because of that. But we know that, like taking supplements, vitamin D, for example. Vitamin D is so effective in keeping the immune system strong. Why isn't everybody taking it? I don't know. If a doctor prescribes hydroxychloroquine, let's say, for COVID, they give you vitamin D and zinc as part of the protocol. So why isn't everybody just taking vitamin D? It's so cheap. It's pennies a day. Keep your vitamin D levels up. So there's a disconnect between what goes on in healthcare and what the science says should be going on in healthcare. And that's why we do these shows. I am not saying don't do what your doctor says. I'm not saying you don't need surgery. I'm not saying you don't need medication. I am a big fan of surgery and medication if necessary. But let's put together protocols that make sense. Let's start out with the most effective, least expensive treatments for whatever the condition is, and then build it from there. Nutrition. Obviously, the most easiest one to fix. Now, years ago, people were told to smoke. My mother was told to smoke when she was pregnant with me. She said, smoke, it'll help relax you. And smoking was a big commercial thing. You know, if you're going to be skinny, if you're going to be sexy, you should smoke. If you're going to be cool, you should be smoking. And then finally, over time, the science was there. The medicine was not. And finally, the disconnect was fixed. And people said, stop smoking. I hope that someday this happens with nutrition. I hope that someday we say, okay, the number one treatment for heart disease is a plant-based diet. It's quick, it's easy, it's inexpensive. You do it yourself. The research is out there. It's so clear. McDougall's done the research. Esselstyn's done the research. Sinatra's done the research. These are medical doctors. And they've done the research on plant-based diets and heart disease. And it's really clear. The science is there. We just got to get medicine to catch up to it. So if you have that chronic cough, back to where I started 6 minutes ago, if you have a chronic cough, many times it's a stomach pushed up against the diaphragm. Get your test done. Find out what it is. But if that's the case, let's start the most effective, least expensive treatment with it, as we should for all, I feel. If you're cold all the time, could be that you have an underactive thyroid. Now, a lot of people have an underactive thyroid. They don't know it. Now, you may think that, well, everybody else is just overheated. No, you could be cold all the time. And you start thinking, wait a minute, everybody in the room is comfortable except me. I see this as a recurring theme. What could it be? Could be a thyroid. Now, here's the most common problem that I see with thyroid patients is they don't have enough iodine. Now, the way the thyroid works, your thyroid gland produces hormones, T1, T2, T3, and T4. The numbers, 1, 2, 3, and 4, correlate to how many molecules of iodine are attached to that hormone. So T1 is 1, T2 is 2, T3 is 3. And so in many cases, people are not getting enough iodine in their diet. Now think about this. Where do you get iodine from in your diet? If you're the average American, the only place, or one of the few places you're getting iodine, is from iodized salt. Now you shouldn't be eating salt. Salt is bad for you. But we put iodine in it because we realized that if there's iodine in salt, people use salt, at least we get some iodine in their bodies, and it prevents goiters. Goiter is an inflammation of the thyroid gland. Now, the way the body works is when a gland is malfunctioning, it gets bigger. The body's pretty smart. My father had heart disease. He had a rheumatic fever as a child, wasn't taken care of medically, should have had medical treatment, and he didn't. And the infection got into his heart, and his heart got huge. His heart took up almost a whole area of his lung. And the heart got bigger to make it work more efficiently. Thyroid, same thing. Pancreas, same thing. So many times, as a gland gets bigger, it's trying to do its job. And a real simple thing we can do to get the body to do its job is give it some iodine when it comes to the thyroid. Now, I get my iodine from Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I take a scoop of each. I like the mint-flavored Super Greens, if you want to know my personal favorites. And I take a scoop of each. I shake it up with some coconut milk, almond milk. This morning I used a frozen banana, whipped it up. And I take that every single day. That's the minimum supplements I think everybody should be taking every single day. Again, there's more you should be taking, in my opinion, but at least Super Greens and Essential Source. And we put sea vegetables in Super Greens and Essential Source. You don't taste them. But they have the sea vegetables, which is a great source of iodine. Most people don't get enough iodine. That's why their thyroid doesn't work. Many times that's why they're cold. So we can put you on thyroid medication, but there's no harm in making sure you're getting enough iodine. And many times that solves the problem. And then hopefully you won't need the medication. Now, I'm not an endocrinologist. I can't tell you to take drugs or not take drugs. Sometimes you need thyroid medication. Absolutely. But let's try to do everything we can to get the thyroid to work more efficiently. Maybe, just maybe, we can reduce or eliminate the need for the medication. So I like to work in conjunction with my endocrinologist, my cardiologist, my neurologist, my neurosurgeons, vascular surgeons, to try to get the patient the best care possible. And it works really well in most cases. Now, if you need the medication, absolutely take the medication. The other thing with thyroid conditions is many times it's an autoimmune disease. What does that mean? The body is attacking itself. So the body attacks itself and attacks the thyroid, causes the thyroid to malfunction. So the treatment that I recommend for everybody with autoimmune disease is follow your endocrinologist's advice. But also I want you to give up 2 foods. I want you to give up wheat and I want you to give up dairy. Wheat and dairy can inflame the body and aggravate autoimmune conditions. So I do recommend you give up wheat. Recommend everybody give up wheat and dairy anyway, but especially if you have autoimmune disease. That would be Sjogren's, rheumatoid arthritis, thyroid conditions. See what happens. If it doesn't work, it doesn't work. So what? You gave up wheat and dairy, but it'll work somewhat, if not all the way. And you'll be very happy that you made that decision. So it's a real simple, easy thing to give up on. So if you're cold all the time, it could be an issue with the thyroid gland, and many times it's something as simple as iodine. Now, somebody came to me the other day, and they said, Dr. Joe, look at my tongue. And they stuck their tongue out, and it was brightly colored. So it looks like it was kind of bright red. And I looked at their diet, and their diet was just horrific. It was just fast food and junk. And I said, you may be lacking B vitamins, specifically B12. So I put them on Dr. Joe's Super Greens, Dr. Joe's Essential Source, and Dr. Joe's B Complex. And a couple of days later, they came back in. The tongue looked a lot better. So if you have a brightly colored tongue, your tongue should look pink, not really bright red. That's usually a sign of B12. Cracked lips. If you have cracked lips, especially around the corners of your mouth, many times that's a B12 deficiency. Now, vegans, people who don't eat any animal products, are at high risk of having a B12 deficiency. Now, that is not a reason to not go vegan. I've been vegan for 35, almost 36 years now. It's not the reason to not go vegan. You just have to supplement with B12. People that eat a high meat diet are deficient in a ton of nutrients, but they're not in B12 usually, ironically. So I always recommend, of course, Super Greens and Essential Source, minimum supplements you should be taking. They have B vitamins in them, and then I take an additional Dr. Joe's B Complex every day. B Complex is great for the nervous system. It's great for the brain. It's great for energy. And so, and if you have too much B vitamins, to a point, you're just going to pee them out anyway. And so it's relatively inexpensive too. So it's probably not going to hurt you to take an extra B Complex. But cracks around the lips, especially in the corners, bright red tongue, B12 deficiency. Anemia, it can lead to things like pernicious anemia. If you don't have B12, I'll cover that if I have time later. So B12 is really important for a lot of different things. And so if you're not getting enough B12, doesn't hurt to add a little extra to it. I always look at it that way. There's some supplements you don't want to overdose on, like vitamin D. Too much vitamin D can be dangerous. Vitamin A, vitamin K. These you don't want to get too much of. But most of the water-soluble vitamins, vitamin C, vitamin B, it's going to pass right out. If you take too much vitamin C, you're going to get diarrhea, and you know you took too much. Really, that's pretty much the downside of too much vitamin C. So it's a good idea to kind of make sure you're getting all the nutrients that you need, and that's why I strongly advise that A, you eat a good diet, and B, you take supplements. It's a relatively inexpensive protocol. I don't see any reason why you shouldn't be doing that, as long as you're taking the right ones. And all the supplements we talk about are on our website, drjoe.com. Now, sometimes you could have numbness or tingling in your hands. That can be a vitamin B deficiency, but most likely it's a pinched nerve in your neck, or in the low back, it would be your feet. So if you have numbness or tingling, you're probably a good candidate for chiropractic care. In fact, if you have any back pain, neck pain, headaches, numbness, tingling, sciatica, let's start with the most effective, least expensive treatment, which would be chiropractic care. I can't understand the disconnect here. If you have pain, chiropractic care should be your starting point. We can't help everyone. There are patients that come in periodically, not often, but periodically, and we look at them and say, you know what, we need to get you out to our neurosurgeon, our vascular surgeon. I had an employee the other day, both numbness in his hands and feet at the same time, had trouble moving. Got him out to a neurologist right away. Had a workup, nothing wrong. But we wanted to make sure. So we work very closely. In fact, what we're doing now is we're putting together a referral network of doctors. And so that's going to be available on the website pretty soon, where you can then say, okay, these are people that Dr. Joe would recommend. Who should I go to? I have this condition. Who should I go to? And we'll probably have some options there for you as well. So we're going to set that up for you on the website real soon. It's going to be free to you as well, which is going to be nice. So we talked a little bit about gluten earlier when we talked about the thyroid gland cutting out wheat. If you have brain fog, walking around in a daze, especially after you eat, even if you're sleeping well, you're trying to exercise regularly, you just can't get the brain working properly, cut out the wheat and the gluten. Let's see what happens. It's free. Costs you absolutely nothing to cut out your wheat and your gluten. Give it 2 weeks. Give it 4 weeks. If it doesn't work, well, I was wrong. I'm never wrong. But if I'm wrong, so what? You gave up wheat and gluten for a couple of days. So if you have that brain fog, you're tired all the time, simple, easy fix. Cut out the wheat, cut out the dairy. Super Greens and Essential Source, B Complex. Nitric oxide is another supplement I take every day. Gives you a ton of energy, opens up your blood vessels, increases circulation to your whole body. So these are things you can consider as well. And I can't imagine why you wouldn't be taking supplements, because I hear every day patients say, Dr. Joe, I can't afford not to take your supplements. I eat less food. I have more energy. I sleep better. My love life improves. My brain fog is gone. It is so much less expensive to take supplements than it is to not take supplements if you need them. And most people do. So, by the way, if you want to make an appointment, you can go to our website, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area. And my doctors would love the opportunity to be your doctors. So if you have a health issue, you want to make an appointment, you can go to our website, drjoe.com, and you can book an appointment right online. It's really simple, really easy. Or you can call us. We're more than happy to talk to you. If you have questions, there's a little bot that pops up. Would you like to chat? Send your questions to us. We're happy to answer your questions. Search the website. You have a specific issue? Type in what you're looking for, and chances are we've done a podcast, we've done audio, we've done a video, we've done an article on it, and you could listen or learn from there as well. And you could find out what it's going to take to try to get you well and keep you well. Again, we can't promise results. We never can. But I've been doing this almost 38 years now. We're getting pretty good at it. So if you're serious about wanting to get well, drjoe.com. We're more than happy to set you up an appointment. Normally, if you paid for everything between the first visit and everything we go through, exam, x-rays, consultation, first adjustment, nutrition evaluation, going over the x-rays with us, it's about $720. We've reduced that to $299. And we accept most insurances, car accidents, sports injuries. If you're ever in a car accident, folks, you got to come see us right away. If the car was damaged, chances are you were damaged. I've never seen it not happen in 38 years of practice. So if you're in an accident, see us right away, because if you don't, it can affect your case. The insurance companies sometimes play games and say, well, you didn't go to the doctor right away, so we're not going to cover this case. That's just an excuse. They know better, but it's just a little thing they can throw in your way. Now, if you cause the accident, you still need to come see us. You see all these attorneys advertising, a lot of them are scammers, by the way, saying that, if you're in an accident, somebody hit you, we're going to get you all this money. That money is not yours, by the way. You got to cover attorney's fees. You got to cover hospital fees. You got to cover doctor's bills. You got to cover testing. So when they say, I got $700,000, no, you didn't. That's kind of a little stretching it. Yeah, the settlement was for that, but you don't get that. So come see us right away. Even if you caused the accident, you still were hurt, you still need to get the care that you need. And again, we accept most major medical insurances. A lot of car accidents have coverage even if you caused the accident. A lot of people don't know that. Your coverage will cover your health care bills. It's called MedPay. Now, a lot of people don't know they even have this on their policy and they're paying for it. You might as well use it. And it can't raise your rates. If you use your MedPay, it cannot raise your insurance rates. Other reasons can, but not that. So whether you're in an accident, if you cause it, if you didn't cause it, if you're a passenger in a car, come see us right away, drjoe.com. So let's keep talking about some other symptoms you might have that can be serious and you don't even realize it. If you have a brown streak underneath your nails, your fingernails, or your toenails actually, that could be a sign of cancer. Now, it's not always a sign of cancer. If you see those lines underneath the nails, you might want to go get that checked out by your medical doctor. Don't come see us for that. It's not within our wheelhouse. Go see your medical doctor, get that checked out. And again, we're going to set up a referral network for doctors real soon, and you can just look up the doctors that I'd recommend on the website. We're working on that, and it's a lot of work to get the website set up because it's going to be interactive. And so I've got somebody who's setting that up for us, so hopefully that'll happen soon. If you start smelling things that aren't there, if you get a whiff of something like rotten eggs, wet dogs, something that's unpleasant, and you know it's not really there, that could be a sign of a neurological issue, something wrong with the brain. Now, it could be something as simple as inflamed sinuses, but it could be something like a brain tumor, epilepsy, Parkinson's. So if you start having this phantosmia, it's called, which is phantom smells, you might want to get to a neurologist and get that checked, just to make sure. Now, I have no problem with testing, and I love when tests come back negative, because it means we know what it's not. And a lot of patients come to us with their neck pain, back pain, digestive issues, nutrition issues, and they say, Dr. Joe, I've had all these tests, and nobody can figure out what it is. Great. We know what it's not. Now we have to dig a little deeper to find out what it is. And usually in cases like that, it's a pinched nerve and or a digestive issue. We need to fix the stomach, and or a nutrition issue. And usually if we get the nervous system working, the digestive system working, and your diet straightened out, in most cases, whatever the condition is, there's a positive response. It may not solve all the problems, but it's certainly a positive response. And that's what we're looking for, is the body getting better. Speaking of nails, if your toenails and your fingernails turn blue, that could be a sign that you need to get your heart and your lungs checked out. It could be a circulatory issue. It could be an oxygen issue. It could be anemia. So if your fingernails are blue, your hands are cold all the time, not a bad idea to get that checked. Because in many cases, it's something you want to catch as early as possible. The earlier we can catch any condition, whatever it is in the healthcare world, the odds of you getting good results skyrocket. They get much better. The longer you wait, the harder it is. I've had people come to us with 2 years, 5 years, 10 years, 20 years of pain. And usually by that time, there's arthritis, the discs are worn out, the muscles have weakened. And so it takes a lot more time and a lot more work to get that fixed, if it can be fixed at all. Here's my rule on pain. And I'm board certified in chiropractic and orthopedics and pain management and nutrition. I've got 5 board certifications, just traumatic brain injury. If the pain lasts for more than 2 or 3 days, you need to come see us immediately. If I work out, I'm a little sore, I do some yard work, I'm a little sore, it might not be an emergency. But if you've got something that's lasting for more than 2 or 3 days, it's something you want to come see us right away. No reason not to. If it's something we think we can help, we'll tell you. If it's something we don't think we can help, we're going to tell you that too. We're not going to waste your time. We're not going to waste our time. My doctors, you can imagine, are extremely busy. And so if you're serious about wanting to get well, you can go to our website, drjoe.com, book an appointment with us. We'll get that set up as quickly as possible. And if it's not something that's within our wheelhouse, most things are, by the way. But if it's not, we refer you out. We have a referral network. Like I said, we're going to put that on the website, and we're going to make that work. All right, some other things. drjoe.com is the website. drjoe, D-R-J-O-E. If you have muscle cramps all over your body, could be several things. It could be your low in potassium. Could be pinched nerves, which is really common. It could be that you're simply dehydrated. I have patients all the time come in, and we start working with them. We give them what I consider some of the best chiropractic care in the world, the best health care in the world. And we're still not seeing the results we want. We do a dietary workup. We look at them. They drink no fluids. They're so dehydrated. Drinking coffee, drinking tea. They're so dehydrated. We just have them simply start taking water. And then along with the nutrition, the supplements, the super greens, the essential source, the B complex, whatever else we give them, and the chiropractic care, we see some amazing results. Now, folks, I'm going to have to go to a break here. If you have any health questions, you can send them to me through the website, drjoe.com. I'm more than happy to answer them for you. The website is over 2,000 hours of podcasts. You can search the website. And if you're a podcast junkie, go to your podcast service and type in Dr. Joe, D-R-J-O-E, for the health of it. And that's our podcasts that are out on all the podcast services as well. But we want to be your doctors. We want to get you well and keep you well. So get to the website, drjoe, D-R-J-O-E.com. I'm Dr. Joe Esposito. Hey folks, Dr. Joe Esposito here. I am glad you're with us today. What we're doing today is we're answering a lot of the questions that come in on our website. Now, we get a ton of questions on our website, drjoe.com, people wanting to know what to do with certain issues. And many times I have an answer. Sometimes I have to say, listen, you need a neurologist, you need a cardiologist. It's something that is not within our scope of practice or our wheelhouse. But usually I can give you some advice to deal with the issues as well as getting an evaluation if necessary. Most cases, we don't need outside evaluations. Most of the patients that come in our office, we are able to deal with in-house, which is great. So we try to get the best results we can for you for the least amount of money in the fastest amount of time with the least amount of side effects. And that's why we always say that chiropractic is the most effective, least expensive treatment for back pain in most cases. Not everyone, but most cases. We can't fix everyone. But a major majority of our patients complain to us after a few weeks of treatment, and they say, why didn't I do this sooner? Why did I wait so long? And I don't know that answer. I don't know why people wait at all. If I have a health issue, I go right away. A while ago, I remember I was seeing flashes out of my eyes, and it was on a Saturday. And I called my eye doctor, and she came in on the weekend and checked me out. And she goes, nope, you're fine. I said, good. I want to find out right away. I didn't want to wait till Monday. I paid a little extra because it was an emergency visit, but it was worth it to me. Because when it comes to health, the faster we get to the problem, usually the better results we can get. So let's go into a bunch of questions that you guys have sent me and some other things that pop up. If you sweat a lot, constantly, all over your body, not just your armpits, not just your hands, but everywhere, and you feel very anxious, you probably want to get checked out by a cardiologist. Because this can be a sign that the heart is not working properly. And if the heart's not working properly, the body sends up these sympathetic reactions, these fight or flight messages. Hey, something's wrong. Fix me. That anxiety, that feeling of impending doom, pressure on your chest, sweating a lot. These could be heart issues, and you want to get that checked by a cardiologist, or certainly at least a medical professional, as quickly as possible. Don't play around with that because it may be too late if you wait too long. Other things, your eyes turn yellow. I had a patient a couple of months ago come in. Their eyes were yellow, and it wasn't real bright. It was yellow. It can be called jaundice, and sometimes the skin actually starts to turn yellow as well, and it means the liver isn't properly breaking down something called bilirubin, and that's a pigment that can cause yellow coloring in your skin. You might want to get your liver tested right away. It's not something you want to jerk around with, especially if you have a family history of liver problems and or you have a bad diet and or you drink a lot of alcohol. Don't wait, get it checked. The good news about liver conditions, it's the fastest healing organ in the body. So in many cases, we get to the liver, we get you on a good plan to stop putting the junk in there, the alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. Stop that going in. Then we get you on a good supplement protocol. Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Glutathione. Glutathione, master antioxidant, great for getting the liver to heal. Milk thistle, great for getting the liver to detoxify itself. And then also we make sure the medical doctor's aware of what's going on. And the liver, it so often heals so fast. But the longer you wait, the more damage there is. Scar tissue can form in the liver. Fatty deposits can form in the liver. And it's a lot more challenging. When I went to school a couple hundred years ago, we were taught that if you see fatty liver, it's caused by alcohol. That was it. One question, one answer, done. Now, we see something called non-alcoholic fatty liver. Non-alcoholic fatty liver can be caused by too much sugar, specifically fructose. And where do you see fructose? How about something called high fructose corn syrup? It's everywhere. And it's in so many different products and junk foods and sweeteners and breads and candies. And fructose, when it gets into the liver, has to be converted into something called glucose. Glucose is the sugar that your body uses as a fuel. So fructose converts into glucose in the liver. In the process, it gives off a waste product called uric acid. Uric acid can get in your joints, and it can hurt. So I see a lot of patients, of course, as a pain clinic and a wellness clinic. We see a lot of pain patients, and we do a dietary workup on every one of them. And then we sit down with the patient. We say, these are our recommendations. Now, whether you do them or not is totally up to you. We can't make you change your diet. We can't make you take something. We can't make you get chiropractic care. But why wouldn't you? It's why you're here. And if we can get people to get the spine and all the joints in the body lined up the best we can, if we can get them on a good diet, if we can get them off the bad foods and eat the good foods, if we can get them to start, if they have acid reflux, start seeing us so we can pull the stomach down away from the diaphragm. And by the way, you can't do that yourself. If there was a way to do it yourself, I would have figured it out years ago. You cannot get the angle. You don't understand the anatomy, the physiology, the vectors, the physics that goes into pulling the stomach down away from the diaphragm. So I wouldn't recommend you try it because you might hurt yourself. So come see us. Let the professionals do it. And let's get the stomach fixed. Let's get the diet fixed. Let's get the nervous system working. And in most cases, whatever your health condition is, you're happy with the results. If you'd like to make an appointment, you can go to our website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctor. We accept almost every insurance. I think one or two we don't accept. And the only reason we don't accept it is because they don't pay enough to make it worth our while. Some insurance companies, you wonder why doctors don't accept insurance. Let me go off on a tangent here. The insurance companies make it so impossible to fill out the paperwork and follow their guidelines, and you got to do what they say. You can't, no, this person doesn't need that. They need what I think you need. No, the insurance company says, got to do what they say. So in many cases, doctors don't accept insurance because it's just not worth it for them. Now, we have cash plans available that are pretty much going to match most insurances because your copays are ridiculous, as you know. It used to be a big issue. Nobody even talks about it anymore. Copays, deductibles, crazy. So if you want to be a patient, and again, about 50% of our patients are cash patients, you can go to our website, drjoe.com. You can book an appointment right online, or you can call us. We're more than happy to get that set up for you. Again, offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area. So we're talking today about questions that people send me and symptoms and signs that could mean something more. If you urinate a lot, it could be a sign that you might have diabetes. Now, if you drink a lot of water and you urinate a lot, different story. But if you can't make it through a movie, you can't make it through dinner, you got to wake up a lot at night, and you're not drinking that much water, it could be a sign that you might have a diabetes issue. And it's called polyuria, poly meaning many, urea meaning urine, so a lot of urine. And in fact, the word diabetes comes from the Greek words for siphon, to siphon fluid out. So when a person has diabetes, they have high levels of sugar in their blood. The kidneys filter the blood. The sugar gets into the urine. And because of osmosis, the sugar, which is a salt, but anything that dissolves in water can be a salt, it pulls fluid in because it's salt. It pulls it by osmosis. And then you effectively create this large amount of urine. And that's a big issue. So again, a lot of urination, and maybe you have a family history of diabetes. Maybe you have a bad diet. Gee, surprisingly. If you listen to the show we did on diabetes, if you go to our website, drjoe.com, and just type in the word diabetes in the search bar, listen to the show we did. We covered a lot of health tips on diabetes. And here's the thing with type 2 diabetes. In most cases, you can reduce or eliminate the need for medication for type 2 diabetics strictly by changing your diet. And once again, we talked about this earlier, the disconnect between science and healthcare. The science is there. Proper diet, high fiber, certain supplements can reduce or eliminate the need for most type 2 diabetics medications. And yet, I've never had a patient come in my office that's diabetic and say, my diabetes doctor told me to eat better, change my diet, plant-based, certain supplements. Never heard it before. Gymnema is a supplement we use for diabetics, helps stabilize the blood sugar. There's many others. And I'm just amazed that the science and healthcare there's such a disconnect there. And diabetes is a perfect example there. But listen to the show we did on diabetes. Do what your doctor says. Always do what your medical doctor tells you. Add this. Add the nutrition, add the chiropractic, add the supplements, add the stomach manipulations to your protocol. And let's see if we can get you well enough so you don't need the medication. You might never get well enough to not need the medication. But what if we could? Wouldn't that be cool? And in a lot of cases it is, because patients come to us all the time. We see it. Doc, I did everything you said. I went back to my whatever, cardiologist, endocrinologist, whatever it is. And he said, my blood work is looking better. We're going to reduce that medication. Blood pressure. We're going to reduce the medication. Or we're going to eliminate the medication. And inevitably, the doctor says, well, what are you doing? Well, Dr. Joe Esposito told me to do this, this, and this. And the doctors inevitably say, keep doing it. Nobody argues with it. I've never had a doctor argue with me. Because I'm not saying stop your treatment with them. I'm saying let's add this to it. Doctors say, whatever you're doing, keep doing it. It's working. I've had patients for every cancer, kidneys, stomach issues, liver issues. And not everybody gets well. But in most cases, we get great results. If you wake up with a headache, could be several things. Number one, and the most common, is that you have a pinched nerve in your neck. I know I have severe damage to my neck. I got hit by a car, played football, hockey, street fights, had a stupid childhood. and I damage my neck pretty bad. If I sleep, if I wake up with my head turned to the right, chances are I'm going to have a headache. I got to come into the office, get my doctors to adjust me, and try to calm down that headache. So if you wake up with headaches, many times it's the bones out of place pinching nerves. And so chiropractic care becomes the most effective, least expensive treatment in most cases for headache cases. So why wouldn't you do that? You might want to come see us. Now, you could also have sleep apnea because you're not breathing properly, and that can cut off the oxygen to your brain, and that can cause an issue too. Now, sleep apnea is usually caused by the stomach pushing up against the diaphragm. When the stomach pushes up against the diaphragm can't drop down, so you can't get oxygen, and you have that snoring. You know people like that? Usually caused by the stomach up against the diaphragm. Pull the stomach away from the diaphragm. We also check the fourth cervical vertebrae, because the fourth cervical vertebrae, that's where the nerve comes out of the spine called the phrenic nerve. The phrenic nerve controls the diaphragm, which goes up and down and sucks air in and out of your body. So if you have a pinched nerve in your neck, it could be causing headaches, but it could also be affecting the phrenic nerve, which can affect the diaphragm, which can affect your breathing, which can cause sleep apnea, which can cut off the oxygen, which can cause headaches when you wake up in the morning. So in our offices, we always do, every case we do, like I just said, let's go down a rabbit hole. Let's try to find out where the problem is coming from and get to the cause of the problem and not just treat the symptom. It's a very different approach in healthcare. I don't know anybody else that's doing that. And that's why we get patients literally from all over the world come to see us. We have doctors and hospitals and insurance companies and judges send us patients. Take a look at this and let's see what we can do. And in most cases, great results. Not all, but most. If you start to lose your eyebrows, it could be a thyroid issue. Talked about thyroid earlier. Eyebrows tend to be thin as we age, but hypothyroidism, that's when the thyroid gland stops putting out as much thyroid hormones, can cause eyebrows to fall out. Usually the hour to third of the eyebrows are affected most. Now the good news is once you start treating it, the eyebrows grow back. Now, if you have a thyroid condition, or you think you might, go to our website, drjoe.com, and type in the word thyroid in the search engine. Listen to the show we did on thyroid. We covered a lot of topics in that thyroid show that we did, and maybe you'll pick up some pointers that you could utilize as well. And that's what's so cool about the website. We've got thousands, at least 2,000 hours of podcasts, audio and video. Some people are visual learners. You try to listen to something, you drift away. With audio, you can pay attention. That's with video, I'm sorry. So we have the video of a lot of the lectures that we've done. You can watch the videos. Listen to the audio when you're working out, while you're doing gardening, while you're driving. A lot of good information on that website, and the cost for all that information, absolutely free. I can't make it any easier for you folks. I'm not going to come to your house. That's the only way I think I can make it easier for you. But if you have health issues, go to our website, drjoe.com, type in what you're looking for, listen to the podcast, send us your questions through the website. If you want to make an appointment to come see us, we'd love to have you as a patient. drjoe.com. It's all over the website, folks. It's right on top. Want to make an appointment, ready for a consultation, book an appointment. It's usually at the top and the bottom of the page and usually in the middle of the page as well. Click on it, brings you to a calendar, send in the dates you think are good. My staff will call you, let you know if those dates work, give you all the information you need. Can't make it any easier for you, folks. And everything that happens in first visit and second half of the second visit, the total value is about $720. We're going to reduce it down to $299 for you. And we take almost all insurances. So there's no reason why you should be suffering any more than you are. Go to the website, book an appointment for you, your friends, your family, and your children. If children start out healthy, chances are they're going to grow healthy. If they're crooked, they're probably going to grow crooked. So bring your kids in as well. They need care too. They have spines just like you. How young can I adjust a patient? The youngest patient I ever adjusted was fresh out of the womb. So probably about 3-4 minutes old. The oldest I ever adjusted was well into their hundreds. So we can adjust you from cradle to grave, folks. And hopefully that's going to extend that time a lot longer too. If your hands, we talked about this earlier, if your hands get cold and if they're pale, that can be pinched nerves in the neck, could be anemia. Now, if you're taking things like acid reflux medication, the acid reflux medication lowers your stomach acid. You need stomach acid to absorb certain nutrients like calcium, B12, iron, and magnesium. Many times when patients are on acid reflux medications, they're low in calcium, B12, iron, and magnesium. And so you need to do an extra level of treatment to get the patient well. A, we try to pull the stomach away from the diaphragm, so hopefully they don't need that medication. And then B, we'll do a nutrition workup on them and make sure they're getting the proper nutrients. Now, you need stomach acid. Stomach acid breaks down proteins. Takes proteins, unravels them, it looks like a ball of yarn, chops it up into something called amino acids. The amino acid tryptophan becomes serotonin in your brain. Serotonin makes you happy. Serotonin becomes melatonin, helps you sleep. Tyrosine becomes dopamine. Dopamine gives you pleasure. Glutamine becomes GABA, suppresses pain. So your digestive system is so key when it comes to you being healthy. And if you're not breaking down your acid, your stomach acid isn't breaking down proteins properly, it can lead to a myriad of other health issues. And in many cases, again, here's the disconnect between science and treatment. We try to treat each individual symptom. You have low serotonin, we give you medication. You have low melatonin, we give you medication. You have low dopamine, we give you medication. What if we found out why you have these low levels of neurotransmitters, and let's go ahead and fix it? And that's the approach we take in our office. We try to get to the cause of your healthcare problem and not just treat the symptoms. And most of our patients really like that approach. So if you'd like to be a patient, drjoe.com, book an appointment right now. Other things you might see as symptoms. If your cuticles, part of your fingernails there, are bright red, they should be like half moon and kind of white colored, it could be a sign of an autoimmune disease, like lupus. So if you have an autoimmune disease or think you do, go to our website, drjoe.com, type in the word autoimmune, listen to the shows we've done on autoimmunity, and we talk about how to stabilize the immune system. We don't want to stimulate or suppress, stabilize. Vitamin D, so important for the immune system. Glutathione, important for the immune system. Probiotics, important for the immune system. I take all those every single day. You should too. So again, if you have these signs, it could be something that there's something wrong. If you have a lump in your breast, men and women, especially under the armpit, it could be cancer. You want to get that checked out, not by us, by a cancer specialist. Now, might be nothing. Could be just a swollen lymph node, which in most cases it usually is. But if it is there, you want to get that checked out as quickly as possible. I personally send out cancer patients to Cancer Treatment Centers of America. I have no affiliation with them. I get no payment from them, no kickback, nothing. I just love their approach. Their approach is they try to use holistic approach as well as medical approach. They take the best of all worlds, which is what we try to do in our offices as well, to try to get to the patient the best results. And they have amazing success rates. So that's where I try to send my patients. Cancer Treatment Centers of America. Again, I have no affiliation with them whatsoever. I just like the work they do. Now, if your fingernails have white spots in them, it could be that you're low in zinc. Now, zinc is really important for the immune system. So if you have white spots, it could be a zinc deficiency. We can do tests, by the way, in our offices. We can do a micronutrient test to determine if you have certain nutrient deficiencies. We can do allergy testing if you have food allergies. But zinc is pretty common to be deficient in. You can get it from like red meat and poultry, but I don't recommend you eat red meat and poultry. But you can also get it from beans, lentils, legumes, things like this. Seeds, wild rice can also get your zinc levels up. If you have a scratchy throat, if you have something coming on, so to speak, I always keep around my house zinc lozenges. Because when you suck on the lozenger, the zinc goes down into the throat and can bind to the virus. When it binds to the virus, it prevents the virus from then replicating. Taking zinc as a supplement can be good, but the lozenges seem to work better because it actually comes in contact with the virus. So scratchy throat, zinc lozenges all day, every day. I think they're great. Try to get the ones that don't have a lot of sugar in them or a lot of dyes. Some companies have these bright red ones and they're real pretty. You don't need that. Simple tablet, suck on it. Get the zinc down into the throat. Really, really important. But again, spots could be on your nails, could be a sign of zinc deficiency. We talked about cold hands and also B12. Vegetarians or vegans are at risk of that. That's why Super Greens, Essential Source, and a B complex I take every day. You probably should too. Most B vitamins, if you take too much of them, you're going to pee them out anyway, which is great. If your heels are cracked, anybody have that problem? Heels get all cracked and ugly? Check your thyroid. If you have that condition, you can sand them down and you can put lotions on them. That's all well and good, but it could be a thyroid condition, so it wouldn't hurt to get that checked. If your ankles are swollen, could be a sign of high blood pressure. Now, there's two types of swelling that we can see in the ankle. One is called pitting edema. Pitting edema is this. You've played with Play-Doh when you were a kid. If you push on the pitting edema and it stays there, like Play-Doh, that's a sign. It could be a sign of congestive heart failure. So when I see patients like that, I like to get a cardiology workup on them. If you push on it, bounces back, it could just be pinched nerves in the low back. The nerves in the low back control the blood vessels in your feet. And so many times we adjust that low back area, open up the nerve and blood supply into the foot, solves the problem. Could be high blood pressure as well. Get the blood pressure under control, and that works. If you have high blood pressure, go to our website, drjoe.com, and type in the words blood pressure in the search bar. Listen to the show we did on blood pressure. Blood pressure could be a sign that there's a digestive issue, because the nerves that control the digestive system is called the enteric nervous system. That's controlled by the vagus nerve, and the vagus nerve also controls your heart. So in many cases, I see somebody has high blood pressure, it's a digestive issue. We got to fix the vagus nerve. They may not be drinking enough water. Chiropractic care, adjusting the atlas, the top bone in the neck, many times has shown progress for helping people with blood pressure. So we always try to get to the cause of the problem and not just treat the symptoms. Now, if you have to treat the symptoms, absolutely do it. But getting to the cause, along with treating the symptoms, is the approach we like to take in our offices with our patients. If your stool is black, that could be a sign of a stomach ulcer. It could be bleeding. It's called occult blood, and it could be bleeding in the upper part of your digestive system. If it's red blood, it's called frank blood, or red blood, that can be that you could have hemorrhoids. You may be cleaning your bottom too aggressively. I'm a big fan of bidets. Bidets are very popular in Europe. Now you can buy them for about $30, hook it onto your own toilet yourself. It takes about 15 minutes to do. Much more gentle on taking care of your hygiene, and much more effective too. If there's too much red blood, it could be that, like I said, hemorrhoids, it could be you're too aggressive. Hey folks, I just realized I'm almost out of time. I got so much more I need to cover. If you have any healthcare questions, send them to me through the website, drjoe.com, drjoe.com. If you'd like to make an appointment to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area. We would love to be your doctor. We are very good at treating car accidents. I even taught a whole seminar for a bunch of doctors, physical therapists, attorneys on how to deal with car accident cases. So car accidents are a different animal. Not every doctor knows how to deal with the case of car accidents. We're really good at it. So if you have a health issue, neck pain, back pain, shoulder pain, headaches, numbness, tingling, sciatic pain, car accidents, make the appointment right now. drjoe, drjoe.com. You can book it right online. You can call us. We'll get you set up as quickly as possible. Stop suffering needlessly. I'm Dr. Joe Esposito again, drjoe.com.